Hi all, I just wanted to go over Module 5, make sure there wasn't any confusion about the module. Um, so we have patient education as the title. In this one, you will do some patient education to an assigned case, simulated case in Shadow Health. So what you'll do is you'll do the assessment in Shadow Health. You'll write the SOAP note, but you'll further the plan in the SOAP note to include a discharge education for your patient that you were assigned. So you're going to develop that plan of care. You're going to role play yourself delivering this discharge education to a simulated patient. So you should record yourself doing this, and you can choose one of your classmates or a friend or a family member to play the role of the patient, and you would be playing the role of the nurse, nurse practitioner, nurse specialist, and we have a neurology case, musculoskeletal, case, and we have a mental health case. So you are assigned to one of those. And let me just pull up our announcement. And you can see here in the announcement who was assigned to which one of those. So if you go ahead and you click on the announcement, you come right up to that assignment there, and the instructions for the assignment are in there. There's the objectives, the overview, and it talks about what's in a plan, and that is the non-pharmacological interventions, pharmacological interventions, educational needs for both the patients and the caregivers. You'll think about follow-up and any referrals. And so that what components to include in your plan are based on the patient that you assessed. So you will want to make sure that when you're doing your shadow health that you've gotten all of the answers right in there, and especially the diagnoses, so that you are developing a plan of care for the correct diagnosis. So, you can retry those, go back in as many times as you want. So I would just recommend that you use all that correct information that you have in Shadow Health to develop your plan of care. So once you've recorded that, you can do it using Zoom. And then when you click record, it will record. And if you say record to your computer, it will put it in a folder entitled Zoom in your hard drive in your computer. And you'll want to submit the MP4. And I can just show you what that looks like. All right, so if I go in here, documents, you'll see here there's a Zoom. And let's see if we just go into a post practicum. You can see this one here at the bottom says MP4. Or if I blow it up a little bit or change it to a different view, you can see it says video there. So you want to submit that in this module. So the instructions do have a recording on how to record yourself doing that. So the deliverables for this are the plan. So you're going to write the plan in Shadow Health, but then also write it in a Word or a Google Doc. And this is the plan that you want to deliver to the patient, their discharge education for their condition. So you're going to submit that under the assignment tabs. Going to submit the recording of you role playing, delivering that patient education. So submit the MP4. And then what you'll do is you want to debrief on that, how that role playing went, because that's really where a lot of learning happens during the debriefing. So you're going to debrief on that and write a one-page reflection, and you're going to submit that as a Word or Google Doc. So those are the three things that are going to be due in the assignment here. Let me know if you have any trouble submitting that. If I go to the submission, file submission, let me see here, file or text. I'll put that so you can submit anything in there, including like a link to the, if you put your MP4 into a YouTube form or Kaltura, you can submit it there. Okay, the other part, let's go into here. We'll go into, so I just want to show you in the learning resources, there are all the different types of debriefing methods. So you want to choose one of those methods or models when you're doing your debriefing. So use that model as the framework for that. And then in Shadow Health, you should do all three of these, even though you're only assigned to do the discharge education on one of those. So you'll do all three, you're assigned to one of these, and that one you will further develop as discharge education for the patients, and role play that, and then debrief on that one case you were assigned to. And the discussion just asks you a little bit about these debriefing models. So you'll go in there and you'll think about, describe one of the models, one that your classmates haven't picked yet, and you will just describe the debriefing method or model, what the goals are of this method or model, how it's used, and where would be the ideal setting it would be used in. And you can also put something in there about, if you've used one of these methods or models before. All right, so I think that is it for this module. Also, the epiphanies and muddiest points are also in there too. So please email me or call or text if you have any questions about this model, this module. Okay, thanks so much. Stop my sharing there and stop the recording.